Hello, my people. Welcome to today's video. This is Nurse Ify. I, I just want to welcome each and every one of you to this video. If you have not subscribed, please hit the subscribe button and the notification bell so whenever I upload, you'll be one of the first people to get it. Okay? So today, like you see the title, um, American Nurse. So I've had a lot of questions about becoming an American nurse, especially from people from African countries, Nigeria, Kenya, and all that. So I just wanted to do a short video on this again. So I've done something like that before, but I want to also be very clear on this video. It's just going to be very short. So, first of all, if you want to be a nurse, you're already here. Apply to the schools. I always advise people, especially because of language and fast thing, to start with the community college. It is usually a little slower. You take all the prerequisites. There are so many prerequisites for you to take. There is English, which we known as Comp 1 and Comp 2. There is anatomy and physiology, humanities, psychology, introduction to psychology, developmental psychology, then public speaking, then you have nutrition and all the rest of it. Then there is humanities. But in the nursing school in America, there are two different types. We have the LPN, which is known as the licensed practical nurse. These licensed practical nurses, the only prerequisite I think they take when you take what is called placement test. So after the placement test, they place you to take the anatomy and physiology, which is not like it's kind of like a crash program, like a 1 month. After the 1 month anatomy and physiology, then you go into the real nursing where you do the fundamentals of nursing, and then you start going to clinicals and all that. Okay, so and this LPM program usually is 12 months. 12 months, which is 1 year. So in that 12 months, you're going to do the fundamental anatomy, not anatomy, medical, surgical, nursing, maternity, and pediatrics and the mental health. So each module you do, usually they do like the class I'm teaching now is they do 2 days in the clinical site and then 2 days in the classroom. Okay, so I have the second semester class. They are in clinicals with me on Monday and the Wednesday. Then the third semester class, which is the final semester, they are in clinical with me on Thursday and the Tuesday and Thursday. So on those days that they are not in the classroom, they on those days they are not in the classroom, they are in the clinical. On the days they are not in the clinical, they are in the classroom. And then we have the first semester that is coming soon. Then our third semester will be passing out by the end of by the beginning of I think either the first week of September. Okay, so they will be leaving and then they go for their preceptorship. The preceptorship is that they are assigned to a nurse whom in a facility. So they wake up in the morning, they go to work, they work the shift that the nurse work. At the end of that, then they are required to take NCLEX. So the NCLEX is the board exam which every nurse have to take before they can allow to practice. And when you pass the NCLEX exam, you will have the nursing license, and then you will have the authority to practice, do every other thing. So that is how that works. But if you want to go to the RN route, then you have to take some prerequisite like I listed earlier. So after taking this prerequisite, then before you can apply into the nursing program, because if the school accepts you, that does not guarantee that you have already been accepted into the nursing program, because that's one thing that most people don't understand. I have problem explaining that to my niece. When the school accept you, they accept you, and then you take those prerequisites. And after taking the prerequisite, depending on your performance, and there is another test that you're going to take, depending on your performance on the prerequisite and the test, then they could take you in. And they usually, each one of them, like each one of they say you have your GPA is 3 points, you get like 1 point for that. You did so good, maybe you have 90 in the entrance test, you get another point for that. So it's a point system. So they add up all these points, and so the higher points, the people who have the higher points will be accepted before those people who have a lower point. So hopefully, the people who fail that test, that period will be more, so that way you can be accepted into the program, or you did even marvelous, because the entrance test is comprises of English and the mathematics and the some basic sciences. A lot of Africans, we do very well in the mathematics. Is very simple mathematical question. The only place I know most of us, or even me, I didn't do very well was the English part of it. So, but the math part of it, and statistically, I have seen it that most Africans do very good in that mathematical test. It's the English part of the test that we don't do very very good. So, and those that are born here do better than most of us when it comes to those reading and comprehension tests that they give. Okay. If you have any other question, send me an email, call me, text, comment. I will be glad to help. Thank you, and wish you the best. Make sure you subscribe.